Jessica, what is it that you do for a living?
Sure. I'm a registered nurse and a nursing professor.
Okay. And what is work like for you right now with what we understand as the governor's COVID shot mandate coming down as of the end of next week?
Sure. So I'm not sure if you have time for it today. I have quite a bit of data for you from boots on the ground within about 15 facilities in Maine. For myself, I was actually one of the nurses that was terminated on September 30th from one of my 2 jobs. And that was as a result of the mandate. So I do know quite a bit of information still going on in that facility out of the 15 I have today. And I can certainly share that with you when you're ready.
Okay, well, we're always ready.
Yeah, we'll take notes.
Yeah, we'll take notes.
Sure.
There are a lot of things going on. A lot of information is coming in over the transom, really. And we're getting, I'm saying we, the reporters who do these things, we're hearing that we're getting ready to roll out vaccines for younger children. We're hearing that there are outbreaks in Maine. We know about the legal aspects. The federal courts are not dealing with it. So what are the numbers that you're seeing in hospitals?
Okay. So it's up to you if you want me to kind of go through the facilities as I have them marked up, or if you want me to just do more of a general what the mandate's causing. I'm not going to lie, George. It's causing quite a hit on our already strained healthcare infrastructure. And one of the fights we have at the moment isn't just about vaccine choice. Governor Mills has one of the harshest mandate guidelines with no testing alternatives. We're trying to prevent a devastating crisis. If you don't mind, before I get into some details, certainly interrupt you at any time. It's your show. Mills stated that anyone who is placed in the care of a healthcare worker has the right to expect, as do their families, that they will receive high-quality, safe care from fully vaccinated staff. I can promise the public that based on what boots on the ground are reporting, that this mandate has far-reaching consequences, which include many across our state not receiving the high-quality, safe care that Mills has promised they would get. Nurses and other healthcare workers can only deliver this excellent care if the circumstances they are working under afford them that option. And I can assure you, as a nurse, and from boots on the ground, that a nurse's vaccination status has nothing to do with the care he or she will deliver and how fast a firefighter puts out a fire. As I get into some of these details from what's going on inside the hospitals, I'll start with a few EMS departments. Wyndham EMS staff is down 25%. As you know, even when we're down 1 truck, the former employer I had was Reddington Fairview General Hospital, who had their own EMS service. When we're down even 1 truck, which is staffed by 2 individuals, that's quite a holdup for people. That's 911 ambulance calls not getting called. That's people not getting transferred where they need to go. This is a matter of life and death for some people. The Portland Fire Department is down 8. United Ambulance Service in Lewiston right now is down 2 paramedics, 1 advanced EMT, 1 basic EMT. They will be down trucks, which translates again into the difference between a life saved and a life lost. The North Star Ambulance is losing over 14% of their staff. The Barron Center, which houses over 200-plus people in Portland for long-term care placements, which is quite a need in our state, which is suffering. They've already terminated 20 staff members. A nurse in a nursing home, Rick and George, a nurse in a hospital may staff anywhere between 4 and 6 patients in their assignment in a day. Nursing homes can see up to 12 patients in their assignment. So if you're taking out of those 20 staff members, you just think maybe 5 of those are nurses, which I can guarantee they are. 5 nurses can translate into 60-plus people not being able to be seen, needing to find another place, maybe outside of the state, away from their family members. Moving on to hospitals, let's talk about some of the bigger ones first, as that has quite the impact. Not saying rural does not, because the little communities can suffer greatly. So Maine Medical Center has been on diversion for almost 2 days now with no beds. One of their post-op units, which is where they send their joint replacement patients, knees, hips, has been closed due to inadequate staffing for several weeks. Their patients are sleeping in recovery rooms overnight, and they had to hire a travel nurse, just to staff their nighttime shift. Most of their elective surgeries are being canceled or have been canceled. They have a capacity of 636 patients, and at the worst, they have seen 45 patients that are designated as COVID patients. So I want to do the math for you. 45 of the 636 inpatient beds that they hold at that hospital, that means that the worst they've seen it in January, only 7% of their beds were used for COVID patients. As of Monday, only 4% of those beds. So what we're doing is Governor Mills has set this mandate and given the premise to people, COVID's bad. COVID's bad just like a lot of other things we see as nurses and that we deal with at the bedside. But this mandate is not warranted given the numbers of COVID patients compared to other things. And COVID, by the way, in Maine, I'm sure you guys have quite a bit of details yourself, but it was the eighth leading cause of death. It's not number one, number two, number three. There's a lot of other things we need to be focused on, and we're primarily just focusing on COVID. 12% of beds, by the way, when you compare it to 4 and 7% at Maine Med, 12% of those beds are taken up consistently. This is consistently for patients needing a nursing home, while nursing homes are being shut down around us for staffing issues. Again, interrupt at any time. I've only done one hospital out of the 15 I have. Eastern Maine. People are calling out when they're sick, but people are now calling out and admitting they're calling out because there's plain old exhausted and not wanting to come in due to the burnout. 2 travelers were just fired this week for poor performance. So not only are they paying them 4 times the salary of us nurses who have been loyal to them over the years, they're hiring travelers at a rate of $140 to $160 an hour. The average nurse with over 5 to 6 years experience is only getting in the 30s, the low 30s at that. They're paying $140 to $160 an hour right now for these people to come in, and then they're turning around and having to fire quite a bit of them for poor performance. So that's not good either. Maine General, that encompasses mostly where my data came from, and that one is the Augusta campus. But I have nurses from multiple units writing into me. It's standing room only in the waiting room. 445 job openings currently, and they're expecting it to rise over 700 once the mandate takes effect on the 29th. Patients are in the halls or waiting area for hours. People coming in with tragic events are not getting services such as case management and chaplain services. Record number of call-outs. A lot of the vaccinated staff have been the ones that have been calling out with symptoms and being sick, some coming to work and being told to come to work even though they're symptomatic with the virus. The only ones in 2 of the units who haven't missed work are the unvaccinated. And I'm going to keep moving on because you seem to be okay with it.
Jessica, I want to jump in and ask something because you've done an excellent job of sharing with us a contrasting perception when we hear statistics like that from the Department of Health and Human Services saying that 80% of Maine school staff and teachers have taken the COVID-19 shot. And then yesterday, the Department of Public Safety, and George referred to this earlier this morning, saying that 96.9% of emergency medical services licensees are complying. It's those that aren't complying which actually add up to some hard numbers and create the situation that you're sharing. But let us ask you this. If the governor did allow testing to prove that healthcare workers are negative for COVID-19 and come back in and do their jobs, would it alleviate these problems?
Oh, significantly. Significantly. There are some staff who have already moved on. I myself have already accepted another position. Many have left. Some, I say many, I don't want to use the word many. There are several from each of these facilities who have just left healthcare altogether. They're calling it sick care. They said, I'm done after seeing all this we've went through. They're burnout. They're devastated from what just happened. They feel betrayed. They have left the complete healthcare system. Some, I have a great friend who's opened her own business up. She's a private provider. She left a facility that she brought in quite a bit of money for them. So it's not just losing staff. They're losing money in doing this. They're actually losing quite a bit of money. She worked in neurology, so that's a pretty big area for money to be coming into a rural area. So you will certainly see many come back, and you certainly will see much of this, what's going on right now, this devastating crisis will certainly turn around. But you've got to act quickly. There's a lot of people. They have 8 days. Some of these people have till the 29th. Some of us were fired on the 30th of September. There is definitely still hope. There's definitely still hope. So we ask for prayers. We ask for you guys to advocate, for everybody listening to advocate. This is not good. I don't know if you heard recently about, as of October 25th, there will be no emergency care at Wells, Maine location. That was announced, the Wells Emergency Care Service update. Wells, Maine has a population in 2021 listed as 10,933 people. Tell me where 10,933 people, they have to drive at a minimum about roughly 18 minutes, it's about 12 miles, 18-minute drive for emergency services. Even if they call 911 and get an ambulance, if they have the staff to do that with the shortages, that's quite a drive. Because that ambulance has to get to you and then pick you up and bring you back to that facility. And who's to say they can even see you right away? Because they're already dealing with the York population. They've been asked to divert to the York population for their emergency services. So, you got to think of all those little things add up. All these things are putting quite a burden on our state.
Well, let me ask you the question. Is the fact that the nurses and staff members are not taking the vaccine causing the problem, or were you already short-staffed? Okay,
so some of these facilities certainly had short staffing, but most of this that's going on today is because of this mandate. I can tell you right now from just the hospital that I left, we were doing okay. We had some positions up that were posted for quite a while. People weren't filling, we weren't getting travelers, but we were not dealing with this kind of level of people walking out the door. And they didn't let me go back. They didn't walk out the door. They were asked to leave. They were told to leave. I had a job that I loved, a dream job. I had worked myself up the ladder, got my master's degree, built a mentor program for the hospital, which is one of few in the state. I was a manager, supervisor. Love my job. I mentored quite a few people. I've had quite a few text messages coming in from people throughout the hospital from all different departments telling me what was done was wrong. They miss me. I've left quite a legacy there. And that's great and everything. The problem is when I took that job that I told everybody was my dream job in 2019, pre-COVID, when I looked at my badge and I would show people my joy of that job, I said without a doubt, George, I will be here until I retire. I would have never left that hospital. At the same time, things are meant to be, and where I'm going, it's all meant to be. It's fine. I have peace in all of it. But it certainly was quite devastating. I went through my grieving process. Actually, I was probably completed with my grieving process about a week before it actually came to fruition, and I'm grateful for that. But there's a lot of people that are suffering for this, and a lot of people that are bitter and angry. And, even if we turn this around today, we will lose some of those people because of what they've went through. This is pretty tough.
Jessica, according to the Department of Health and Human Services and their dashboard, which was last updated, I checked it late last night, last updated on the 13th, it said there were 5,700 healthcare workers yet to, their word, comply. If they don't, and we go beyond October 29th, how long, in your opinion, you've got a lot of facts to share, you've got a lot of insight. Jessica, how long after the 29th can the healthcare facilities in our state maintain operations at the workforce loss that they are going to suffer that you've described, that you've illustrated to us? How long can they continue?
Rick, I can't speculate at all, but I'll tell you right now, lives will be lost. I don't know. I don't want to share some details of things I know because I still, believe it or not, love the facility I left, and I really respect a lot of people in behind those walls. But I'll tell you, some of the things I've been hearing, they've reached towns away from the hospital, have just got out loose to me the other day of how quickly they're discharging some of the people. People are going to die. People are going to die. That's what I'm concerned about, because if this is truly about public health, this is not the answer. It truly is not the answer. I'm begging for a change in this policy. There's alternatives, there's other things, and like I said again, I don't know how long they're going to last, Rick. I'm very, very concerned for our state. I really, truly am, and the nation is watching our state. We are leading this country right now with what we choose to do with this. This is not good for our people. This is not good for you, George, your family members. And this isn't just if you're sick. This is when you're going to have someone in your family is going to have a baby. This could be a trauma that's unexpected. This is not good. And I don't know how long they'll stay open. I do believe facilities will continue to close. I believe those who are, based on my personal relationship with people, over 2,500 people in the coalition that know a lot of information inside these walls, but also from their great relationships I'm maintaining in my own former facility. I can tell you that those who are left behind are burnt out beyond measure. They're also calling out for mental health days. They're thinking of leaving, traveling to other states just to get out of here. They said, if I'm going to make this kind of money here, working this hard, I'm going to go somewhere else where this isn't going on and make quadruple my salary. They're getting, bribe, of course, with, double time, bonus money for picking up shifts. People are working 5 to 10 shifts in a row. They're going to get burnt out. Money only lasts so long, and we were told, that mills might take away their license if they don't comply. Their reimbursement rate from CMS is going to be much better if we're all vaccinated. They got to think long term. That money is going to dry up, and what's going to matter is the public health, our safety as a population in Maine.
Mm. GHRT Rewinds, brought to you by your hometown real estate team, Laughlin and Wolfington Realty. Thinking about selling your home? Call 629-9211 and start packing.